So the Undersecretary was here yesterday, the Deputy Assistant Undersecretary was here this morning, and now the Assistant Undersecretary herself, Dr. Carolyn Clancy, is joining us to deliver a keynote. I have a bio for her. Historically, she has preferred I not read the whole thing, but I'm happy to read the whole thing if you'd like. As she comes to the stage, I do want to make sure we all recognize Dr. Clancy serves as the Assistant Undersecretary for Health for Discovery, Education, and Affiliate Networks for the Veterans Health Administration. The Office of the Dean fosters collaboration and knowledge transfer with facility-based educators, researchers, innovators, and clinicians within VA and between VA and its affiliates. And I can say with absolute confidence, none of this would be true within VA if not for the leadership of Dr. Clancy. So thank you so much for being here with us today.
Well, good afternoon, and thank you, Anne. I think that may be the best introduction I've ever had, the middle of the Oreo. So true confessions, that's what I eat in Oreos. In general, I try to stay away, but every so often I can't quite resist. It is such a privilege to join you today and help shine a spotlight on the amazing innovations and advancements being made in immersive technology VA-wide. So many of the innovations I talked about at last year's summit are now on their way to becoming, if you'll excuse the pun, reality for both veterans and VA staff. Many more have been scaled and implemented to benefit veterans and staff across the organization. When I was just hearing about Mr. K, I felt a deep pang of sadness. I have a cousin who died early in the pandemic, not from COVID, but from ALS. She'd had a very, very long, unusual course, but to be able to go places I can no longer go, that would have been an incredible gift to her. I want to thank all of our colleagues who made this week's summit such a tremendous success. Dr. Ann Bailey, of course, just amazing, amazing energy, dedication, and passion. Caitlin Rollins, Evan Davis, where are you? Somewhere here, doesn't happen without him. Amber Brown, Anu Osideku, Dr. Jared Wiesweber, and Dr. Billy Rutherford, who I think I just met over here. Over the past 2 days, you've heard from colleagues at the forefront of immersive technology and have had the chance to experience some of the amazing applications firsthand. So now that we're at the summit's midpoint, I'd like to suggest just some big picture themes for you to keep in mind. One is ensuring that this technology works for patients and providers. Of course, so many of you are really, really excited about it, but you got to be able to do it at home too, right? A second is understanding VA's unique role in developing the evidence to support emerging technologies like immersive technology, including virtual reality and augmented reality. Empowering employees to be change agents in healthcare transformation, fully leveraging the power of collaboration, and to borrow a phrase from General Crossland at the Defense Health Agency, this allows patients really to get closer to being the CEO of their own healthcare and what they need. So, no matter how exciting technologies are, we have to stay laser focused on the veteran patients we serve and stay grounded by keeping some very important questions in mind. The first, they're fun, but do these really work for patients? What better way to find out than by involving veterans in the planning? Veterans themselves contribute in significant ways to the development of immersive technology when they participate in pilot studies of VR and AR technologies. For example, Josh Maloney, an Army veteran who had been deployed to Iraq, experienced symptoms of PTSD that went undiagnosed for years. He turned to alcohol in order to cope, and after seeking help through a detox program, he met a VA nurse who told him he had PTSD, which he'd already suspected. He learned of a VR exposure research study that allowed him to address his trauma by confronting his triggers while in a safe environment. Recounting his experience, Josh said, "It was my first time using VR. There was a dichotomy in my brain between I'm perfectly fine and I'm freaking out. And I'm perfectly fine was winning." That's success. We also look to frontline staff, those closest to our veteran patients, who go above and beyond to use these technologies in new ways to meet the unique needs of their patients. So yesterday, for example, you heard from Jonathan Tang, a recreational therapist working at the Phoenix VA Healthcare System's Community Living Center, who's dedicated himself to keeping his patients up to date with technology, so much so that he enrolled the entire Community Living Center in a VR pilot. His first participant was a veteran who had been at the CLC for 4 years. When Jonathan's patient learned his condition was terminal, he expressed the wish to visit his home in the Virgin Islands one more time. Since travel wasn't possible, Jonathan set up a headset to take the veteran on a 360-degree virtual tour of the islands so he could virtually visit his home. I think some of you have probably seen this video clip. It's just amazing. Following the virtual tour, the veteran told Jonathan, "I've never felt closer to home than I was just now." Sadly, he passed away shortly after that experience. In addition to asking whether the advancements work for patients, we have to ask ourselves, are these technologies easy to use by all groups? Do they work for providers? What is the evidence? We're committed and focused not only on expanding the application of immersive technologies, but also ensuring its evidence-based implementation across VA and paving a new path for healthcare delivery. While developing and testing new innovations in immersive technology is an ongoing endeavor, we're focused on the continuous evaluation of VR and AR technologies to ensure they're effectively meeting the needs of veterans and staff. For example, through our Quality Enhancement Research Initiative, fondly known as QUERY, we funded a 2-year evaluation of RelieveRx, an at-home chronic pain VR solution. It consists of a headset and software that guides patients in pain management exercises and is the first and only immersive VR pain treatment that has been FDA approved as an adjunctive treatment for chronic lower back pain. The RelieveRx pilot study is part of a quality improvement effort to determine whether it's a valuable addition to care for veterans experiencing chronic low back pain. Think about that. How much better than that, than the side effects of opioids and all kinds of other stuff that we give people? I mean, could be utterly amazing. Another example, earlier this afternoon you heard from Dr. Megan Rumsey, who spoke about the power of storytelling to demonstrate the impact immersive can have on veterans. She and Dr. Carla Figuera also conducted a pilot study of an at-home chronic pain VR application to assess its benefits in an outpatient setting. The study revealed that pain intensity decreased by an average of 22% when comparing pre- and post-immersion pain scores, and by 12.7% when comparing baseline pain scores with the end of the analysis. Further, patients reported that VR usage reduced their stress and improved mood levels. Some patients were even able to reduce the use of as-needed pain medications through their VR experiences. I can't even imagine how liberating that has to be, not to be tied to constantly taking medications. At the most fundamental level, though, transformation begins at the front line. VA is the largest integrated healthcare system in the U.S., with healthcare facilities and outpatient clinics across the country. Our frontline staff serve as change agents in developing best practices and working with us to disseminate those best practices and innovations enterprise-wide. Transformation is also something we do as a learning organization and part of our journey towards becoming a highly reliable organization, or HRO. This week's summit helps underscore our commitment to supporting frontline staff in the use of immersive technology and helping find creative and practical ways to better train, equip, and engage them. For example, take Moments That Matter, also known as MTM, a VR training program developed to help VA staff understand the inpatient discharge journey through a veteran's point of view, and with the aim of encouraging empathy for patients and enhancing the quality of care they provide, having experienced what it's like to walk a mile in the veteran patient's shoes. As of today, MTM training has been piloted at 10 medical centers and experienced by more than 350 VA employees. Based on an MTM evaluation completed by 214 VA staff members, 93% of participants stated that the training helped them experience empathy for veterans going through the discharge process. 91% stated that the experience will positively impact how they engage with veterans during their discharge journey. The statistics are impressive, but, numbers are kind of flat. As one VA staff member noted, the technology used for this training was incredible. To be able to experience what the patient is going through is something you cannot learn about by talking or reading. You have to experience it for yourself. All staff should go through training where they have an opportunity to experience things from the patient's perspective. Finally, I'd like to offer a few thoughts regarding the power of collaboration. In healthcare especially, collaboration is key to ensuring that immersive technology is designed to meet the needs of patients and providers. Internally, we've facilitated collaboration across VA to support innovation in immersive technology, including with many other program offices, for example, the Office of Mental Health and Suicide Prevention, and I'm pretty sure you heard from Dr. Campbell yesterday. We're also leveraging resources and partnering with subject matter experts and key stakeholders in the clinical space and administrative space, for example, including privacy and ethics, to facilitate and inform collaborations across VA. No matter how you cut it, the best healthcare is a team sport, and VR/AR is no different. We've also facilitated external collaborations to provide opportunities for co-development of immersive technology with industry to address veterans' care needs. Earlier this year, we formed a collaboration with InnerWorld, a mental health VR platform that will provide veterans with an immersive and safe space to engage in peer-to-peer support and will provide them 24/7 access to proven mental health tools and resources, allowing them to build a virtual community. Imagine for a moment people experiencing a lot of mental health symptoms who don't necessarily have a vocabulary for that, right? If you make a phone call for an appointment, you got to have a vocabulary for that. What is your problem? Why do you want to come in? So we see this as just a very, very important prelude, potentially, to additional care. Over 100 MetaQuest headsets equipped with the InnerWorld software have been distributed across 6 VA medical centers. We're also partnering with Mind Immersive, a leading developer of immersive therapies for aging adults and senior living communities. So far, Mind Immersive VR technology has been implemented in 9 VA community living centers across VISN 4. That would be the great state of Pennsylvania. On a scale of 1 to 10, with 1 being terrible and 10 being life-changing, patients who tried this VR technology rated their experience an 8.03 on average. Think about all the Yelp ratings you see, right? You never see anything like this. About 95% of participating patients stated they would be likely or very likely to recommend virtual reality to fellow veterans. So I think you've got the drift here. There's no shortage of research, development, and evaluation efforts underway to expand our capabilities in immersive technology and to amplify the impact it has on veterans and staff. When I visited Ann in Asheville, this was a little bit serendipitous. I was down there for a family reason, but I came by to visit with the leadership team, and Ann brought in a couple of employees who were in their first or second year of working for us. And they are very proud to tell me about the work they're doing. And what I'm thinking is, wow, this is amazing, and these people will never leave VA. Where else could you have this kind of opportunity? That's the kind of sense of energy, and I can be part of important change that I think VR has been a critical part of. The examples of the technologies you've heard about, seen, and experienced these past 2 days speak to how far we've come and to the endless possibilities promised by these technologies. I hope you enjoy the rest of this summit and that you're as excited as I am and we are to continue defining a new reality in veteran healthcare through immersive technology. So thank you very, very much for your attention, and spread the word. Maybe we have a headset for that, but thanks very much.